Welcome to the Universal Group of Institutions. Today we will discuss about CAR T-cell therapy. We all know that B lymphocytes and T lymphocytes play a major role in immune response, where B cell produce antibodies to neutralize the pathogens and T cell destroy the infected cell or the cancerous cell. This CAR T therapy involves T cells, where CAR T cell therapy, also known as Chimeric Antigen Receptor T-cell therapy, where this can also be known as the patient-specific or the tailored treatment for an individual. Here what happens is that the T-cells from the patients are collected and modified. So from the patient, the T-cells are collected and they are modified in the laboratory or manipulated, where these contains the CAR expression or the chimeric antigen receptors on the T cells. So what happens here is the cells which is containing this T cell having the receptors will be expressed ex vivo. Expression will be done in the heavy dosage or the optimum dosage which are required for the patients, and then these T cells receptors will be further infused to the patient through IV, where the patient T cells are collected, modified in such a way that the receptors on the T cells recognize the cancerous cells. After the ex vivo expansion for the optimum dosage, the T cells are later introduced into the patient through the IV. So now these receptors present on the T cells can recognize the cancerous cells or the tumorous cells predominantly and fight against them. Hence this CRT cell therapy or the chimeric antigen receptor T cell therapy can also be called as or considered as tailored therapy or the personalized T cell therapy. Here the mechanism what happens, where the chimeric antigen receptors which are present on the T cell binds to the specific protein. Okay, they bind to the specific protein or the cancerous cell and trigger the immune response. When the immune response is triggered, the cytokines are released and the tumors are destroyed. Okay, so that is why this cells or this therapy can also be called as personalized T cell therapy. Now we'll look into the applications of this CAR T therapy. So the application of this patient specific or the target approach for this CAR T can also be seen in the blood cancers, where acute lymphoblastic leukemia were being treated and chronic lymphocytic leukemia can also be treated, and non-Hodgkin lymphoma can be treated with the help of this CAR T cell therapy. Not only the leukemia, even the solid tumors were also being undergoing this treatment, where the pancreatic cancers and even the immunomodulators are also being produced and can also be applied in these cases. As we know about the applications, let's move on to their advantages. The major advantages of this CAR T therapy is that first thing is personalized, where the treatment is personalized to the patient specific, where we are collecting this T cells from the particular patient, modifying it and again implementing it on the same patient to fight against the tumor. And the second one is targeted attack, where they are very target specific regarding their pathogens along with the host cells. Okay. After the advantages, let's look into the disadvantages or the challenges where the CAR T therapy approaches. The major one is the cytokine release syndrome. As the T cells are activated, the cytokines are released in more number, right? So this is the major factor. Since there is the large release of cytokines, there is the common effects which causes fever, fatigue and the potential severe symptoms seen in the patient. Along with that, the neurotoxicity, which can lead to confusion or seizures in the patients. And the major thing is the cost, not very cost effective that all the patients can afford, but this is being personalized and this target specific, this have the major potential to overcome the tumor. So this is all about the CAR-T therapy. Thank you.